Thank you, Lucia, for the introduction. So yeah, good evening, everyone. My name is Hannah, and I help run the programming here at PreMedCC. I just wanted to provide a brief background and introduction on our speaker tonight. So Dr. Ani Kazanjian obtained her bachelor's in nursing from Johns Hopkins University before serving in the Army as a trauma and perioperative nurse. She obtained her medical degree from Michigan State University College of Human Medicine. While in medical school, Dr. Kazanjian pursued a master's in public health at the University of Michigan, specializing in epidemiology and healthcare finance. Currently, Dr. Kazanjian is finishing her second year as an orthopedic surgery resident at Henry Ford Hospital in Detroit, Michigan. So I'd like to give a warm welcome to Dr. Kazanjian, and thank you for making the time to speak with us tonight.
Thank you so much for having me. It's a pleasure to be here. Can I go ahead and share my screen now?
Go for it.
Give us a try. Okay, I just have a few slides, but just hopefully to keep me on track with my presentation here. So let's see if I can do this. All right, can everyone see my screen? Good, wonderful. Well, this is my first time doing something like this, so thank you all so much for having me. I'm really excited. So I'm going to talk a little bit tonight about my experiences going from nursing, well, first as a, let's see, get rid of the pictures because I'm going to end up looking at myself and that's going to throw me off. All right, there we go. So kind of how I got from high school and to the point that I'm at right now, because I feel like really where I'm now is a just evolution of the past like 13, 14 years of work, maybe even 15. And I don't think I would be where I am today if I had not gone back to the beginning and thought about where I started. So I want to talk a little bit about what it means to kind of build a career in medicine, particularly for me in orthopedic surgery, and then how I balance that as a parent and as a busy resident and with my other interests and goals, because we are not just physicians or not just people who work in medicine. You have other lives and other things you want to do with your time. So we'll talk about hopefully most of those things tonight. Okay, so there we go. All right, so I figured the easiest way to do this would be to just show you all kind of how I got where I am today and talk about each of those things one at a time. So I actually was homeschooled from pre-K up and through 12th grade. And so I know that's very unusual for most people, but actually that's when I started in community college. So it was really a benefit to me. I started at my local community college when I was 15. And it gave me an opportunity to start seeing some different career paths and explore different options. I took a bunch of classes in like culinary arts and thought for a while I was going to do that, and music and just a wide variety of things. And I really appreciated the opportunity that the community college gave me to start working on both prereqs for undergraduate, but also to kind of start thinking about where I wanted to go in my life with my career. I clearly did not end up as a pastry chef, but I'm okay with that. What I do is very artistic, and so I enjoy it anyway. But yeah, so I started there, and then after high school, I decided to go to University of Michigan. I originally started there in the nursing program, and I was immediately rather frustrated with my schooling. And I think that in hindsight, looking back on this, I see this now as like maybe something that should have been a red flag, that I was not in the right career path for me. But I didn't know that at the time. And I actually didn't really know any physicians growing up. I knew a few, but they were all male. They all had partners, wives who stayed at home and raised children. And so I was frequently told that, with the greatest good intentions at heart, that like, do you really want to be a doctor? Why would you go to medical school? You're not going to be able to be a mom. It's so much time. Why don't you go to nursing school? All these things, and I didn't have any role models to look up to see how that could look for me. And it's really hard to be what you don't see. And so I had started in nursing school because I knew I had an interest in healthcare, But I immediately kind of felt that there was some discordance in me between what my goals were, even though I didn't really even know what those were yet, and the school that I was in. And University of Michigan has an excellent nursing program. So I ended up finishing out a year there, being not really sure what I was going to do. I took some more classes at the community college and applied to transfer nursing schools because I thought maybe the problem was that I didn't enjoy the school I was at. And so I transferred to Johns Hopkins. The next year, I had to take some classes at community college to meet those prerequisites. So you'll see there's a theme of me going back to community college to kind of bolster my education and getting kind of leapfrogging from place to place. So that's one thing I really love about my community college experience is that there's a great community college in my hometown, and I was able to return there at least 4 times, I think. I don't think I even put all of them on here, to do classes for prereqs for medical school and nursing school and in high school. And so I ended up at Johns Hopkins. I finished out my bachelor's in nursing there. And while I was in school, I crystallized pretty quickly that it wasn't the school, it was the profession. And I did not really want to be a nurse. I wanted to go to medical school. But at the time, I had a contract with the military, who they were paying for me to go to school, which I'm so grateful for, because I would not have had the opportunities I had without their assistance. But I went to my boss and I said, I really think I want to go to medical school. And he said, well, your contract says you're going to be a nurse, so have a great career. And so I didn't know at the time I could fight that, honestly. And you always get to be the master of your own destiny. Always look at your contracts before you sign them. But I didn't really feel like I had the power to fight that contract at the time. And so I finished out my nursing school and I started working. I don't know if you can see my clicker down here, and I was an Army nurse. So I got shipped off to officer basic and I started serving in the military. And I was frustrated because let me tell you, I didn't want to be there, and I didn't want to be stuck. I felt like I got shunted into this thing. I tried so hard to figure out where I was supposed to go. I'd gone to all these different schools, and now here I was in a career that I didn't enjoy. But I have to say that being in the military was a really formative experience for me, growing as a kind of maturing, growing as a professional. I got to learn a bunch of incredible skills and do a lot of things, help a lot of people that I probably couldn't have helped otherwise. So I'm really grateful for the experience. And it also gave me a sense of patience, which I think carried me through from that point to where I am right now. Because if there's something that I think is really important, I do have a slide with takeaways at the end, but one thing that I feel is really important to talk about is that anything you want in medicine will take you time. And especially if you were like me and you're thinking of changing careers, or you're thinking of going from community college to a 4-year university to then to medical school, anything you do is going to take you time. And we have this perception that we should want something and obtain it almost immediately. We live a culture of instant gratification. And I think that being in the military as a nurse taught me a lot of patience to say, okay, I know where I want to go. Now, how am I going to get there? And not be daunted by the amount of time it took me. So, because really transferring from nurse to physician is almost going back to square one in terms of the, we'll get to that later, but in terms of requirements and things like that. So I worked as a military nurse. I did trauma, and then I knew I wanted to go to medical school. So I ended up requesting to transfer into a position where I got a certification as an OR nurse, so perioperative nurse. And I worked as a periop nurse. And while I was there, because I knew that OR had a better schedule than trauma, I started doing a post-bacc program. I had gotten some of the classes done at community college, but I also did part of my post-bacc at American University in Washington, D.C. And I chose a non-degree because it allowed me a lot more flexibility to do it kind of part-time while I was working. So I did that, and then I ended up applying to medical school. I got into medical school, and then halfway through decided I also wanted to get a master's in public health, so I did that. finally ended up here in orthopedic surgery residency at Henry Ford. So total time from ending school over here at Johns Hopkins to getting to this residency was 10 years, which is a long time. But I really, at this point, don't regret any of it. So I think one of the reasons what I have to share with you all tonight is valuable is that I understand the difference between being a doctor and being a nurse. And if anyone is considering those two different career fields or considering being a nurse first and then going to medical school, like I do have strong thoughts on that, but I also have had a lot of time to think about it. And I think I have a pretty realistic idea of what it means and what you could have that would be a benefit and what would be not a benefit. So the pro, you have a job. So if you go to nursing school first, you have a job, and that's fantastic. And let me tell you, making money is great. Having been a student for a very long time, making money is awesome. It's much better than taking out loans. So it's awesome to think like, okay, I could get this degree in nursing and then I have a job, and then I have a job I can do through medical school. So that's something. It's in the healthcare field, so you will have experience in healthcare, which a lot of people find valuable. It's hard sometimes to find volunteer shadowing opportunities in healthcare. It can provide some networking opportunities, and I did take advantage of a lot of those while I was in hospitals, talking to people, anyone who would listen. And being a nurse is a flexible job. Caveat to that, eventually it's a flexible job. Cons, it's a job. And I think a lot of people don't really recognize that from the get-go. But nursing is a very hard job. Having done both intern year of residency and also being a new nurse, I would say they're equivalently taxing. In fact, I think nursing is more physically taxing. But learning everything you need to learn is very hard. And right out of nursing school, you're not able to find a flexible job. People who talk about, oh, you're a nurse, you can always find a job. Those are people who've worked for a long time and have a specialized skill set, and it allows them to get those flexible jobs. But right out the gate, I think graduating from nursing school, you're going to have to get a full-time job, and you're going to have to dedicate your time and attention. I think the orientation program for the last unit that I worked in was an OR during medical school, and their orientation was 6 months. And so for 6 months, people had to work full time, plus going to orientation activities at the hospital and also within the department. They got paid, but you had zero flexibility in your schedule, and you had to just dig in and learn for 6 months. So that's something I think people don't consider as well, is if you don't put in that time on the get-go for nursing, it's hard to have a flexible job because you will not have the skills that you need to do that.
And your boss doesn't care that you have an exam coming up. You gotta work.
Legitimately, they do not care at all. Like, do not care at all. And I've had that experience many times. So they care that you're supposed to be working and you have a job and you've signed and you've said you're going to be there and you're going to work, so you're going to work. Other things, it's a unique skill set. I am a good nurse. That does not make me a good doctor. It is a totally different job. It has made me able to talk to patients, but it did not give me any, I would say, appreciable advantage, at least for the first 2 years of medical school, because learning like didactics and things like that when you're just in a classroom studying, it doesn't matter that I can start an IV. People want to know if you know your biochemical pathways and can you do well on a standardized test. I then feel like I had an easier adjustment into the schedule of 3rd and 4th year of medical school, but that was only because I was used to working long, hard hours. Learning how to be a doctor and learning what I needed to know, that was not any easier because I was a nurse. They are very diverse. The prerequisites do not overlap. I'm so sorry. I have to. Getting a double phone call from somebody, which is never a good thing. But so the prerequisites don't overlap. So I went to nursing school at Hopkins, and I really wanted to be a doctor. And so I was like, oh, I'm going to take some prereqs while I'm in medical school, or while I'm in my undergrad. Like, I'll just try and like get some things done at the same time. But prerequisites for nursing school and prerequisites for med school are actually totally different, by and large. Some of the generic things, like you got to take English, you got to take a writing class, sort of thing. Those are the same. But nursing school doesn't require physics. It doesn't require ortho. It doesn't require so you can do some biology for nursing school. That part kind of overlaps. I did Gen Chem, but for nursing school, but it doesn't require Gen Chem too, and they don't require the lab. And so I was missing a lot of things. So you'll have to go back and do a lot of prereqs. And so it's about time and when you're going to do that. Different goals. The jobs are different fields, different goals. So what you might have in your head as a goal for, okay, I'm going to do nursing and then I'm going to be a doctor, is not going to be the goal, as Ari's been pointing out, as the goal of your boss or even the goal of your career. And so you might find yourself moving farther away from where you want to be and not closer. There's also a lack of time for research opportunities and other things. Like in nursing school, I think it's been defined as one of the busiest undergraduate degrees you can get in terms of volume of tests and assignments and hours worked. You will not have time. And I thought that I was going to have all this time to do these prereqs, and I ended up doing very poorly and failing classes, simply because I didn't have time to really dedicate to the classes that I was taking in medicine because I was so busy in nursing school. So those are some cons. So to illustrate this more, I have a tale of three students. A little bit, and I'm not saying it's bad to be, I know this probably sounds very like dismal, but I don't regret my past, but I think it's very important to understand what people are signing up for when they decide to go from being a nurse to being a doctor. So you got three students. We got student one. We'll say this person gets a science undergrad. They prepare for all their career options. They don't know exactly what they want to do, but they're like, okay, I'm going to get something basic. They take prereqs for both nursing and medicine, which you can work in if you're not actually in nursing school. And then when they graduate, they can be a little older and maybe know a little bit more about what they want if they didn't know that before, and they can choose to either study for the MCAT or do an accelerated bachelor's in nursing, and that's a year. So that's a pretty nicely timed out thing. Student two did a bachelor's in nursing. They're busy all the time, unable to complete medicine prereqs, conduct research in shadow, which is a problem I had, and decides at the end of nursing school that medicine's the right path. So then you have to spend about 1 to 2 years on post-bacc and resume building, 1 to 2 years of applying for the MCAT, applying to med school and doing the MCAT, and then, as mentioned, you'll have difficulty finding a nursing job in your preferred field because you have no experience. So that will be a very time-intensive process. And then there's student three. Spoiler alert, this was me. I started nursing school. And a lot of people are in this boat. You start nursing school, and for whatever reason, you can't switch. Like, I've talked to people who have children who are the sole breadwinner for their family, who can't afford to continue on in school for the time it takes to be a doctor right now, who would like to be in a medical field, but cannot, for whatever reason, cannot go and pursue that right now. For me, I had a contract with the military. I could not pursue medicine. So I finished nursing school and I got a full-time job. And because of my full-time job, I got experience, certifications, and focused on skill building. And so then once I had been working for about 2 years, I was able to start reorienting my my life so that I could do this post-bacc and resume building. So I did that. Then I did the MCAT. I applied to medical school. And because of the time that I had spent working full-time, yes.
Also tell them the hardest time for a nurse is your first year on the job, right? That's the most challenging.
As I mentioned, it was very exhausting. Intern year versus first year of nursing, like, I remember being equally tired. Like, it's such hard work. Like, I laugh, but it's only because if I don't laugh, I like cry thinking about it. It was so hard. Because it's like you are learning how to save people's lives. And whether you're doing this as a doctor or a nurse, this is what you're doing. And getting your brain to wrap around the tasks you have to do and the work that's required of you is, like I said, mentally and physically draining. So because I had worked all this time in nursing, so people would see me and be like, oh, well, I want to do what you did. And I'm not saying you can't, I'm just saying you need to know what you're getting into, which is that I worked for a long time. I spent 5 years working full-time as a nurse, and then went to medical school. And because I had worked for 5 years, I was able to obtain one of those jobs that people always talk about, the flexible, highly paid and specialized nursing jobs. I made my own schedule. I got paid extremely well. And I could do it through medical school. And because I had been in the military for 5 years, I also had my GI Bill. So that ended up, that's a scholarship from the military, for those of you who don't know, which allows me to get 4 years of education from a state university for free. So I used that scholarship, and because I have this skill set in nursing, I was able to get both my MD and my MPH and have a baby as a single mom and still have less loans than most of my friends. But downside, total time was 10 years. So do I think it was worth it? For me, yes, this is the path that I took. But my friends are all attendings right now. And I don't think they're bad doctors. They're really good doctors. I'm not friends with bad doctors, but none of them have this same circuitous path. And everybody has their own path and their own road they have to walk. And there's value to what I did. And I think it worked out for me and for the life that I ended up living. This is a good path. But I always want to caution people that it's a path that takes a lot of time. So my takeaways are that you can always change your path. I did. I was in a path that people would say you're stuck forever. Like, I had a contract I legitimately couldn't get out of. I had to go to work every day because I had signed on the dotted line and said I would be there. And they could pick me up and they could move me across the country in a heartbeat. And that happened. And I had to switch plans and cancel classes and study for the MCAT while in different states and while like transitioning. And it was crazy, but you can change your path and it is possible. You just have to know it will take time. And time at the end of the day is your most precious resource. So spend it on what's important to you. For example, I'm actually just starting my second year. So you bumped me ahead, which I was grateful for. I wish I was farther along, but I actually am just starting my second year of residency, and I have worked the last 6 weeks without a day off, which, by the way, is brutal. My attending today knew this and ended up finding a way for me to have tomorrow off. And for that, honestly, he's a saint. But it really makes you realize when you're in these situations that time is your most precious commodity. You cannot replace it. And so spending your time on what matters to you is the most important thing. So for me, that, mentorship on, being at my home with my child, spending time with my family, working in my garden, caring for my patients, but, making sure that I'm doing that in a way that's going to be constructive towards the life that I want, even if it's requiring a down payment of time right now in residency. So it's not all about money, but if anyone tells you that they're not in medicine for the money, then they're lying, because you need to make money. And you cannot, this is probably an unpopular opinion, but going to medical school is really expensive. And if you think it took me 10 years to get from where I was to where I am right now, like the amount of years of full-time income lost is quite drastic. It sometimes makes me ill to think about. So if I do not find a way to recoup that money in a meaningful way that I can put into my retirement to make up for the years that I was not investing in my retirement savings, then I have virtually just volunteered my life, which I'm not opposed to, but I have a child. I have obligations. I want to take care of him in a way that's going to allow him to be successful in life. And so when you're thinking about your life, it's important to include your financial goals in that. So whatever they are, and everyone's financial goals are different, but one of the reasons why I chose orthopedic surgery is because I knew it would give me the financial outcome that I was looking for after putting in about 15 years of effort and time and like drastically reduced income. So think about the money. And if you get to the end of the day and you're like, yep, the money doesn't matter to me, then that's fantastic. But just know what your goals are in terms of your time, your personal goals, and your financial goals. So that leads to pick a goal and make a plan. I knew when I was 21 and I graduated from Hopkins as a nurse that it was going to take me 10 years to be a doctor. And you know what? 10 years later, I was a doctor. So sometimes when you make a goal, it's going to be a long-term goal, but at least make the goal.
And I just want to add that you graduated from one of the top nursing schools in the country. So that's by itself is a feat by itself. So
well, thank you.
So yeah, I mean, so you know, you were kind of like getting into Hopkins nursing because they only accept like, was it 60 students a year?
I don't even remember. It was very small.
It's a very
between 60 and 80.
Yeah.
I can't remember.
Yeah.
It's very small.
So you got into a very good nursing school. And how was that process from getting into that competitive nursing school and medical school? And did you feel you were at an advantage or disadvantage?
That is a really good question. I think it would have been an advantage if I had not, if I had just been at Hopkins and I had gone straight to med school, then I think it would have been more of an advantage. But by the time, because at the end of the day, you can get a good education in a lot of places, but name will carry you in some ways. It will open doors. It just will. But because it had been so long since I had been in nursing school than applying to medical school, people were a lot more interested in talking to me about my military experience than they were in talking about my undergrad experience. And I think that's just because I was older. And also because I struggled in undergrad. I was frustrated and angry. I was mad that they wouldn't let me go and be a doctor. I tried to overload my plate, as I mentioned. I failed classes. I failed organic chemistry twice. So FYI, you can be a doctor if you fail organic chemistry. It is possible. But again, that may take you more time to kind of go back and recover from that, but as it did for me. But so I think people were a lot more interested in talking to me about other things that I had done at that point, just because I was older. But it is something to think about when you're considering school. But I will say, like, even though the name Hopkins probably did open some doors for me, even doors that I don't know opened for me because of that. I do think that there's something to be said for finding a place that is going to be truly supporting you in your goals. And I mean, if you've heard anything from me tonight, you know that I didn't want to be a nurse and I was a nurse. So the people that I was surrounding myself with at Hopkins, both in the military program and also in the school, didn't really understand my goals and plans, and I wasn't fully supported. So there are days I wonder if it would have been more valuable for me to go to a less well-known school, but one that maybe people had more of my best intentions at heart. And so that's also something to think about in terms of like your plans. I don't know, does that answer your question?
Yes.
Maybe. Okay. So yeah, I think that was it. Oh yeah, I had one more point. And remember, your life doesn't start when you get to a specific goal. So even though you have a goal in mind, like I knew when I was 21, I wanted to be a physician when I was in 10 years, so at 31. It was hard for me to realize this for a little bit, but I eventually was able to understand that my life didn't start when I got to just a specific goal. So I didn't need to wait until I was 31 to start living my life. And you can see that here. So I had this beautiful child who's here, and have this amazing dog who went everywhere with me. And I made a decision to have a baby as a single mom, and I don't regret that for a single second. And that's a story in and of itself. But this is the path that I'm on, and this is the life that I'm living. And I get to be in this amazing residency program that is so supportive of women. That's another whole question of itself. The number of practicing orthopedic surgeons in the country who are women is 7%. The number of residents, average residents per program is 15%, and my program is 40% women. So they have an incredible push to support women. As you can see from this photo, all of us, they sent all of us women to a research conference. We had one nice male resident who came with us. He also came along to present, but it was mostly just the women from my program, and we had a blast. And I am up here in the top right-hand corner with all of my co-residents. As you can see, we are a female-dominated class of 4 women and 2 men, and it's been a great experience. So I built a life, and I'm happy with it. And I think that there are many ways to get to where you want to go, and just remember that your life is being lived along the way. And that's it.
Thank you so much for that presentation. And we can move on to some people have been putting questions in the chat. So if you don't mind, I'll start asking them.
Okay. Can you see, I've got the chat open, so I'm looking at the questions. Can we all see them, or can I just see them on my screen?
They'll just ask you because it gets recorded. So Hannah
okay.
and Lucia will go back and forth. So you just answer
Perfect.
them and don't worry about reading them.
Okay, sounds good.
Okay, so to start, someone asked, what's the best age to become a doctor, or the regular age, which I guess they are talking about like after undergrad, but I'll let you answer that.
Well, the average age for matriculating medical students in the US when I started was 26.
27.3.
I was going to say it's probably older now, would be my guess. So there you have it, 27.3. And I'm not surprised about that. I think that's actually older than I was when I started medical school. I started at 26. So it's like spot on average when I started. But I think that the push towards that is now that things are becoming more and more competitive, and people are realizing that medicine may not be all they want to pursue in life. And so they spend some time doing other things, getting other experiences, taking more non-traditional, which I think if we all see that the average starting age is 27.3, then that's now the traditional path. But the sort of historically traditional path of going straight from high school to undergrad to medical school to residency is really not what people are doing anymore. The average age, I think for me and my class of residents is almost 30, I think, at starting residency, and is now older now that we're all a couple years in. So yeah, so I think that that's more and more common. But I also think that while there's an average, the right time is when you go. Doesn't really matter what time that is. What matters is you and your life. And I couldn't have gone to medical school at 21 because I had a contract, and there are people who have families to take care of and can't go to medical school. There are people who are in other countries and need to come here and I don't know, go to school here, and they're on a totally different path. The right time to go to medical school is when you get there, and when you get in, and when that's the optimal time for you. And that's based on you and your goals that you make.
Thank you. So this is slightly unrelated, but someone is asking if there are any med schools that you know of that do not require the MCAT.
Most of the schools, and I really can't speak for schools outside of the US because I do not have experience with that. I think there may be some that don't, but I would not recommend such a school. But I can't really speak to those. In the US, there are programs that have linkages, which is probably the closest thing you can get to not requiring an MCAT. So you would participate in a post-baccalaureate program at a university, or you are an undergrad at a university, and you would apply to this program that would allow you to have an early admission decision to medical school. And then you would be able to go to that medical school, and usually it's pending receiving at least a minimum on your MCAT. I do know of one person who had, actually maybe more than one person, who during COVID, they had some minimums in these linkage programs, and because of COVID and the canceling of all the test dates, they told them, eventually please take the MCAT, but we're not going to bar your admission to medical school because you were unable to take the MCAT. So those people did go to medical school without an MCAT. But I think that's a highly unique, like, world pandemic situation. Most of the time in the US, you can come, and we'll say you're accepted, but then you have to get at least a minimum MCAT score.
Yeah, I know a person that during the pandemic, they were accepted, but they also like had a bunch of other things, and they actually took their MCAT the first weekend when they matriculated to medical school. And that was like the last time. And they basically said, if you don't sit for it, we will not let you continue. So it's a pandemic thing,
wow.
once in a century
Yeah.
pandemic. But this
Yeah, I
person
wouldn't have done that.
but this person was a former Navy SEAL. He graduated from I think Yale.
Oh, goodness.
And he had like all of these like outside life experiences that made him a very unique candidate. Like I think it was the Silver Star or Navy's Cross or something. Like he won like a bunch of awards, and so he was a very unique person. But they even told him that you're gonna have to take your MCAT your first weekend of matriculating to medical school, or we will not let you continue. And the reason why he didn't take the MCAT just because he couldn't find a place that was offering it during COVID, and he was also like doing some sort of thing with the Navy. Anyway, so it was like a very unique situation. But as she stated, all medical schools in the U.S. will require you to take the MCAT. There are some foreign schools that will show up here without the MCAT, but they have a very different model that they let everybody in, and it's kind of like then you got to do well on your boards before you could continue, and that's much harder. And the whole thing with the MCAT is they train you how to take standardized tests, and it is the hardest one, but you're going to be taking a lot more MCAT type tests throughout your career, right? Part 1, part 2, part 3.
Part 3. Yeah, don't forget part 3. It keeps going.
And they don't give you any time off for part 3. You literally get off a 36-hour call, and you may have to go take part 3.
Yeah, I got 2 days off in the middle of the week to take part 3, but I worked the weekend before and the weekend after. Yeah, I think I know of a few people, but one person, one of my closest friends, she also elected a non-traditional path, ended up staying in the military a lot longer than me, and did some really, really incredible things. And she got into a top 10 medical school, and they told her she would need to take her on a linkage program. She was in their post-bacc and got in on a linkage program, and they told her she would need to take the MCAT and get a minimum. And she was working on studying when the pandemic happened, was unable to find a test date. They kept pushing it and pushing it and pushing it, and they ultimately told her, you need to take the MCAT as soon as you can, but we are not looking for a minimum score. You can start at medical school whenever, and you can just start medical school. So she had to sit for it as a check in the box, but she didn't actually have to get any particular score. But it was still super stressful because it was during the pandemic, and she was like, it was really, really hard. So again, I think we've really killed this question. But yes, every med school in the US needs it, and unlikely that you're going to get in without needing at least a minimum score.
Thank you. And the next question asks, are students able to work while in med school?
Yes, I worked, but again, I think I also talked about this hopefully enough, but I worked as a nurse all 4 years, but I had a very, very flexible job because I had spent 5 years working full-time as a nurse. So I had a very specific skill set that I could utilize in a very flexible way. When my school shut down during the pandemic, I also worked as a COVID ICU nurse. But again, I got that job because I had been working as a nurse for, at that point, almost 10 years. And I had a very robust resume with all of my skills and certifications that allowed me to jump right into that job with really no questions asked. So other people I know also work after in medical school. There are opportunities to work as tutors. My school had those. I was like offered to be a tutor. I ended up not. You have to be in a certain percentile of your class to be able to start doing that. But I knew people who did that and made a reasonable, kind of like having a side hustle. I didn't do it because I could work as a nurse and make much better money doing that. I had another friend who was also a nurse. He ended up working in a really interesting job. He was on call as a tissue and bone harvester. So after people passed away, and they offered to donate their bodies to the good of mankind and humanity and whatever, they will retrieve organs first, and then he would go in and he would retrieve tissue like eyes and skin and bone and ligaments. And it was a really hard job. And he also had been a nurse for a long time and had extremely specialized training to do that. It was a very lucrative job, and he only had to work about 1 weekend a month. But again, these are jobs that people do because they spent a lot of time preparing for those in medical school. Tutoring, I knew people who babysat, people who tutored for MCAT, tutored for undergrad, things like that. I think there's opportunities to make a little money, but if you're trying to find a way to fund medical school, if you, like me, I had a child, so I had to pay for something other than the loans they were giving me, then you may have to consider a non-traditional path in which you spend a significant amount of time beforehand kind of getting the skills that you need to create the flexible job that will make, enough money that it's worth it. And keep in mind, I probably still gave up points on and I took step 1 when it was graded. So, and we got like a score. I probably gave up points on my step 1 because I worked while I was studying for step 1. I probably gave up points on my step 2. I was 8 months pregnant and working. So it ended up working out for me in terms of my application to residency, but I don't know if I'd recommend it unless you have a solid reason where you're like, I must work or I will never, like, there's no other option for me. And you can get loans as a single individual, or as a person who's in a partnership with somebody. Like if you have a partner who is working or also in school and also had loans, then it's totally possible to live a very reasonable life, modest, but a very reasonable life on the loans that you get to go to medical school, knowing that you will be able to pay those off eventually.
Yeah, and the other thing is we had a financial aid workshop, and basically there's people's job to make sure that you could go to school, and if you take out more loans, you make out more loans. But in California, the average starting post-resident makes a little bit under $200,000 in just a general practice.
Right.
So you are going to make that money, and so take that time to be a great student, strengthen your research, because if you're trying to, and I'm surprised, I didn't know that you worked through medical school, because orthopedic residency is like the most, or like always the top 1 or 2 competitive residencies to get into. Like I know I have a friend who actually spoke here a couple of months ago, but he was doing all this research and all these extra stuff for his residency, and he wasn't in the military. He was just a regular guy, graduated college, worked a couple of years, went to med school, and so he didn't have a lot of these extra things that you had, but he worked really hard to get in his residency to match. And so if you're in medical school, that's your job to be a medical student, and they will make sure you have the money, because the schools have a vested interest for you in doing well on your exams, graduating. Because if you're going to public medical school and you're not graduating all your medical students, the state legislators will have major issues with you.
Yeah, they will.
and even private schools, there will be a lot of issues. So they said something like an average medical student costs about $200,000 in, I think like $215,000 in California. So there are people on top of whatever that you go into. So take that time to not to worry about working. Yes, if you could tutor and make a little money here and there, but you're not going to be able to pay off your loans while in medical,
Yeah.
unless, plus the other thing is you work as a nurse, so you were making a lot more than the average medical student can even,
Hmm.
so you're probably making 4 times of what they were doing tutoring easily,
Oh, far and away.
probably 5 times.
It was a good return on my investment of time. And because of the job that I had, I usually worked afternoons, and there was usually about 2 or 3 hours in the evening where I wasn't working because things would slow down, and I would sit in the physician lounge and study. So I was literally getting paid to sit there and study. But even with those benefits, it was really, really hard. And like I said, I definitely gave up points, and I gave up research opportunities, and I gave up volunteer opportunities. I basically just used everything from my prior experience as a military nurse and my time working and called it my shadowing. And I really just had to like beg, barter, and steal when I made my my residency application to create something that was incredibly unique. And I think that was what got me into orthopedics and got me all the, because I had enough interviews that I was not anxious. I was, but I felt very confident in my application. But I think that was because I'd spent so much time beforehand creating a very unique background and a wealth of experiences in medicine and outside of medicine. And so I did not spend much time on any of that in medical school, whereas my peers who had not had such a robust professional life beforehand spent a lot of their time in medical school on research and volunteer and shadowing and things like that, and kind of building their resume so that when they applied to residency, they also had unique experiences to talk about that made them valuable to programs as applicants. So I think the big takeaway is do what you got to do. I did what I had to do. I had to take care of my child. So, and luckily it worked out for me. But if you don't have to do it, just know that I was tired every single day. Like, there wasn't a day I wasn't exhausted, and there wasn't a day I wasn't like wondering if I was going to get by and if I was going to make it. And like it's been said, this is your career. Like, you basically have one shot. Especially for me, like applying into orthopedics, the match rate is low. The match rate on a second go round is even lower. So I had one chance to make this happen. And if I didn't make it happen, I did not have a job. And it's not like if you don't match, then you're like, oh, I'll just do something else. Like, no, you didn't match. So unless you had the foresight in advance to come up with some crazy scheme to apply to 2 residencies, and that's its own discussion, because it's almost impossible to do that. They make it almost impossible to do that, to apply to 2 different specialties simultaneously. Then you don't have a job. And so I was looking at this as like, I have walked a fine line, and I hope it'll work out. And if it doesn't work out, I have no way to pay for my child. Don't put yourself through that stress if you don't have to. Give yourself the best chance to be successful, and know that this is your career, and what you do for 4 years. Yeah, it'd be great if your choice, and this was, if your choice is, can I go on vacation at Christmas versus should I, study for an extra 5 hours a week? Just study. If your decision is, am I feeding my child versus, maybe I have to choose a different residency, then like me, you're going to choose to feed your child. So, and I'm fortunate that I was able to continue going to medical school and pursue that dream, because a lot of people would have had to give that up. And I realized my privilege in that. So just know what your choices are and decide where you really want to spend your time.
Somewhat related to your discussion as kind of working as like a COVID ICU nurse, someone is asking if you could touch on the flexible, high-paying nursing position that you worked during medical school.
Yeah. So I had worked for 2 years as a trauma nurse for the military, which for sure opened a lot of doors, because it pretty much was a given at that point that I could take care of just about anybody. And so I know that opened a lot of doors for me. So I did that. Then I spent 4 months training in the military as an OR nurse. Then I spent another 1.5 years working as an OR nurse, and then I took a certification exam, like a licensing exam that certified me as like a certified operating room nurse. I worked as a charge nurse. I worked 24-hour shifts. I worked nights and weekends. I worked in the pre-op, like preparation for surgery area. I managed, so like I told you about my friend in medical school who harvested tissue. I then was responsible for actually managing the tissues. That was millions of dollars in human tissue products, and obviously donated and very precious items that people had donated for our use and for the health of other people. So I was responsible for caring for those, monitoring, tracking, making sure they ended up in the right people that they were supposed to end up in, and helping the right patients. So I did that. I managed small teams. I did leadership nursing position. That was 5 years of hard work. And because of that, I was able to very quickly and easily obtain a position as an operating room nurse in a very nice community hospital in about 10 minutes from my house. There's always a need for nurses. And if you have specialized training, then you can do that. And it was a per diem job, which meant that I had to give them a certain amount of availability, but because I worked there for 5 years and they valued me as an employee and I was hardworking and showed up and participated well, they gave me workaround so that I could basically get out of working when I had a very busy month, like when I had my general surgery clerkship. So I would work, I basically could come in and work whatever I wanted to work, and I could work a half shift, a whole shift, I could work any hour of the day or night, because there's always need, and that is true. There's always need for nurses. So, but again, it's because I spent 5 years working full time and getting lots of certifications that I was able to kind of jump into that job. And then because I had already been working there for 2 years and was a reliable employee, when I started clerkships in medical school, the program or the job basically said, we don't want to lose you. What can we do to keep you? And so what I want to stress here is continuity. So I had worked for 5 years as a nurse, and then I worked for 2 years in the same department. And then because of that, they were willing to basically bend over backwards and help me to stay there and keep working. And then when COVID happened, I had been working for almost 9 years as a nurse and almost 4 years in that specific facility. And so when they dropped out of the elective cases in the OR and I was there to help in the OR, so they didn't have much need, I was able to be put in touch with the nurse manager in the COVID ICU and had a glowing report from my current job. And so they're like, yes, obviously you can come up and work for us. And so that's the thing. That's 10 years of basically good credit to my name as a good worker. So those are not the kinds of jobs that you can get right out the bat of nursing school. Those are the kinds of jobs you can get when you're willing to put in almost a decade of work to get there.
Thank you for that answer. And someone else asked, you kind of mentioned this before, but they asked, when do doctors actually get paid after med school? So
yes, we get paid after medical school. It's a beautiful thing. There are opportunities to have scholarships. The military offers scholarships. The National Health Corps offers scholarships. There's lots of things. Your salary is mandated by the federal government. The federal government authorizes a certain amount to each hospital to educate residents, and then tells them that they have to spend a certain amount of that on salary and benefits. So that's basically more or less based on the cost of living in your area. Hospitals find a way around it, but it's basically a system where they don't allow hospitals to pay a lot of money for residents, because then residents would be tempted to go to certain hospitals because the pay is better. So they want you to go places based on your interests and those hospitals' needs, and not based on, this hospital is private and they have like millions and millions of dollars of money they can spend on their residents. But something to keep in mind is that cost of living does still matter. Although your salary is based on your cost of living, there are programs like a certain one in Boston that I interviewed at, which is excellent and would have loved to be there, but they had a lot of hidden costs that were not covered by the residency. And they also have a very high cost of living in Boston that's pretty much equivalent to New York or LA. But unlike programs in New York or LA that have found a way to offer their residents a housing stipend within the bounds offered by the federal government to be able to offer those types of incentives, programs in some places, like this particular program, did not offer any benefits. So I worked out my cost of living, and it was pretty much prohibitive for me as a single parent. So that's something to keep in mind, is that, and whereas now I live in Detroit, where the cost of living is obviously much lower. And so I like where I live, and I can pay for my child, and those things are important. So you will get paid. And as much as they want to say that you aren't gonna, it doesn't matter, because the salary is mandated by the federal government, your salary does matter, and there are ways that they will work around that to see. So those are things you should consider.
Yeah, but I think it starts at 53, I think, right?
No,
53 or 55.
I mean, that seems reasonable. I got paid more. Cost of living in Detroit is actually higher than most people think. Some hospitals, the residents are unionized and can barter for a higher salary, which I think is fantastic. I would love to be in that kind of system, but
yeah,
it kind of just depends.
Yeah, I work in Oakland, and so, but our residents are unionized, and they get $1,200 more a month just for housing stipend, and
Excellent, yeah.
plus whatever. I think it's like 50. I think here it's like 56 starting out. It just depends. Like everywhere is different, but minimum I think 53 or 55,000 post medical school. Your first year resident. It doesn't matter if you're doing ortho, family medicine, dermatology. It's all the same. So it only matters when you're done. Then the pays.
Yeah. And that is something that people often say is frustrating. Like, for example, as an orthopedic resident, work a lot more than my family medicine colleagues. And it is frustrating that we make the same amount of money. But it's your earning potential at the end. And also, like, some things to keep in mind. Like I said, you have to think about the money. It's just a fact of life. We need money to live. And one of the reasons I selected my program was because they have built-in moonlighting opportunities for residents starting after 2.5 years of residency. You can start doing basically moonlighting that's been authorized. And
can you tell them what moonlighting is, because they don't know what it is?
Oh, okay. So it basically means that you work all your normal hours, but we all assume that as you get higher up in residency, you're working slightly less hours. So like right now, I work a lot as a junior resident, and I have a lot of learning to do. But as I progress in residency, my schedule will kind of normalize, and I'll maybe be working, some less hours a week than I am now. Well, I'm currently used to working this number of hours a week, and as my required clinical obligations kind of trail off a little bit more, and I'm working maybe 50 hours a week, 60 hours a week, I'm used to working 80 hours a week. So with the extra time that I have gained, I could go and work somewhere else under my license and make money on the side. So it's like a side hustle in medicine. And what you want is to have a program that has a built-in moonlighting opportunity. You as a resident can operate under your own license, like not operate, but like you can practice medicine under your own license. Once you've completed intern year, I don't know all the particulars, so please don't ask me about that. But I know you can in certain fields, certainly not as a specialized physician. Like I couldn't be an orthopedic surgeon to complete an orthopedic surgery residency. But some programs allow residents who are more senior to begin taking call responsibilities. So like being available by phone to assist patients in clinics or things like that. And it's very complicated. I'm so sorry. This would be like a whole other conversation. But basically, my program, the senior residents, we are a large health system. The junior residents are covering the largest hospitals within that health system. The senior residents are then covering the smaller like clinics and hospitals that are outliers that feed into these bigger centers. We would probably have to cover that call anyway, meaning we have to be available for orthopedic patients that come in through those urgent care centers and smaller emergency rooms and things like that. But our program is generous in allowing us to get paid extra for those responsibilities. So you can take extra shifts and work as a physician under your residency license, which is good. So you're not actually practicing under an independent license, you're continuing to practice under a residency license, which is my preference because there's less liability. So finding a program that allows you to practice in some way under your educational limited license, I think is a huge benefit, and you can make a lot of extra income from that.
We are kind of running out of time, and there are quite a few questions, so I'm going to lump two together that are really.
Oh, and I'll try and do smaller. I'll try to go shorter.
We go to 7:30, but yes, we are hitting our time, and there's a lot of questions. I'm answering some of them in here.
Thank you. I will try and answer quicker too.
So someone says, you mentioned you were extremely exhausted working as a nurse, med student, and taking care of your son. What things did you do to prevent burnout, and how did you stay motivated? And then someone's asking, how did you divide spending time with your son while maintaining such a busy schedule?
Okay, so to answer super quickly, there's no such thing as balance, in my opinion. You will always give something up. So it's about deciding where you're going to focus your time and energy. So how I got up every day and kept doing it was because I had to. I had my son halfway through medical school, and I didn't anticipate being a single mom. That was an unexpected situation for me. But I decided to, because I was fortunate and I was able to pursue that and to have that child, and I wanted him. And so I went ahead with that. And he's the reason why I get up every day and keep going, because I have to. I don't have an option. People can wake up in the morning and be like, oh, I don't want to go to work today, I'm not feeling it. If I don't wake up and go to work, if I didn't wake up and hit it hard every single day to go to work and to study my darndest and to like take every volunteer research, whatever opportunity to build my resume, like at the end of the day, I'm not the one who's suffering, it's my child. And so he is the ultimate motivation that keeps me going. In terms of balance, like I said, I truly don't think there's balance. I think that you will give things up. And there are times like this past month where I feel like I haven't seen my son very much. And that's brutal. But also he's very young. And so I know that the time I'm spending now on becoming a orthopedic surgeon will benefit both of us in the long run so much and give me the time that I want to have with him. So when I'm with him, I give him 100% of my attention. As much as I'm able, and really make that time meaningful, because I know what I lose in quantity, I can really make up for both of us in terms of quality time.
The other thing is a small child, or any child from 0 to a teenager, doesn't care that you're tired, and so you have to be present. At all. You have to be present to them, and so those are the sacrifices you make, and that's why being a parent is a much harder job than anything else you could do in life. That's just personal opinion, but
I don't think it's opinion. I think it's fact. Although my child does look at me and he goes, "Mama is tired." Unfortunately, I think this is just what he thinks about me now. But I did talk to another surgeon who said she felt like she had really let her child down. And now that her child's an adult, her child has told her she wants to be a surgeon, which was shocking. And she was like, well, don't you miss that I wasn't there? And come to find out, her daughter didn't perceive that at all. Her daughter, although it hurt the mom who was the surgeon because she felt like she was gone all the time, she never saw her daughter perceived that she was present constantly, because when she was with her, she was giving her that quality time and attention. And that was so encouraging for me as a parent to know that that's really what matters to children, is that you're there, and that you can't always be there, and there are things you can't control, but when you're there, you are present, even if you're tired.
I don't know. This is what I always tell some of the residents I work with, is just think in 3 to 4 years, you're going to be making very good money, and you could take him on a trip to Disneyland and go high flying instead of working a job at, $80,000 a year and struggling, whereas as an orthopedic surgeon, you can do those things. And like economics, I mean, I don't know. I think economics plays a big part in parenting, because there's things you could do as with income that if you're not if you're not able to do it, it's very challenging. So
money cannot buy happiness, but it can certainly facilitate happiness, in my opinion. And so if you are not a happy person, no amount of money will make you happy. But for me, I looked down at life and I realized that being a nurse, I was never going to be able to stop working full time to support my child as a single mom. But as an orthopedic surgeon, I will have incredible flexibility to do whatever I want. And he will be 6 when I'm done. And he's not going to remember this other than I was busy. And so it's more important that I get this done and get us where I want us to be and have the life that I want us to have.
Yeah. And just on the topic of orthopedic surgery, someone asked how long your residency is.
Residency is 5 years. And then most of the time, most people do a fellowship, which is 1 year after that. That was a nice, easy one.
I wanted to put this one out there because it's basically a love letter to you. It's a little long, so buckle in.
Oh, goodness. Okay.
This person says, "Hi, Dr. Kazanjian. I'm a huge fan of yours and fellow Blue Jay, graduating with my master's this fall. And learning of your story was my sign to go for it and apply to medical school. I'm also a non-traditional applicant and can relate to a single mother in school and the challenges of juggling everything academically, professionally, and personally. What advice would you give your pre-med self when you are applying to medical school amidst everything else that you are navigating? Thank you."
Well, thank you so much. I'm so excited you're going for it. Congratulations. Well, I would tell myself that good things come to those who don't give up. It's really not about talent, in my opinion. It's important to have, a couple brain cells to rub together. But at the end of the day, the people who succeed are the people who won't give up. And I've learned that about myself over the years. And I've seen that play out in my own family, where I had family members who went from saying this is never going to happen for her to saying, well, it's obviously going to happen. And that was simply because I am stubborn as all get out. And if I pick something I'm going to do it. And I think that's what you have to keep in mind is it doesn't matter how many times people say no, you only have to get a yes one time. And that was kind of my story. Was I am not the smartest person in my medical school. I am not the smartest person in my residency. I don't have the perfect grades. I don't have the perfect story of going, swimming along through undergraduate and graduate school and right into medical school with no problem. It was hard work, and there were many no's along the way, as evidenced by the fact that I really sucked at organic chemistry. But yeah, if you really want it that much, it will happen for you. You just have to keep working toward it, and every step you take is getting you closer to that goal. So I would tell my pre-med self not to worry, because clearly all those things are going to happen for you because you're not going to give up.
And just kind of adding on to that, someone asked if you have any advice specifically for non-traditional pre-med school or students.
I would say highlight your non-traditional background. I think the reason why I ended up being so successful in my medical school application and then subsequently in residency applications was because I did not shy away from the things that made me unique. And in the current world of applications, particularly in residency, where step 1 is now pass fail, where it was previously graded, people no longer have that, in my opinion, biased benchmark. So I'm glad it's gone, since I think it was an unfair test for many people. But that's gone. So they can no longer use that test score to exclude people. So instead, they're looking for exclude or include people. So they're looking for other reasons to have people in their programs. And really, I think there's a trend in all programs towards finding people who have more to offer than just their extremely high test scores, because we all know that high test scores do not make you a good doctor. So it's I think play up those differences, talk about your unique experiences and why those things will make you be a good doctor. And also keep in mind that medical school and residency is incredibly hard. And I have many friends who are now attending, but who went straight through from college, and I knew them, as residents when I was a nurse, and they all of them second guessed their decision and wondered if they'd made the wrong choice. And I said to every person that I interviewed with, you don't have to worry about me, because I know there's nothing else that's going to make me happy. I've done everything else, and I want to be an orthopedic surgeon. And so no matter how hard it is to get up in the morning every day and how much I don't want to do it, I will. And you don't have to worry about me quitting. And that's important because, as mentioned, schools have an invested interest in you succeeding. Residencies do not want you to drop out. They're losing somebody who's taking calls, who's working 80 hours a week, who they've spent a lot of time and investment on. They don't want
making
you to quit.
money
That
off of
causes
you.
a problem. You are why the hospital is running. If I learned anything this past year, is that residents are keeping the hospital running, and you are making life easy for the attending. I see a hand consult in the ER, I put somebody's finger back on, and not really, but like the tip of their finger back on. And I see the patient, I do all the work, I put in all the orders, I send the patient out. The attending never sees them, but they get to sign that form that says, oh yeah, I staffed this patient with, Dr. Kazanjian. They get paid. Do I get paid? Not really. They get paid. So those attendings are making money off of your work, and subsequently the larger hospital is making money off of your work. They don't want you to quit, and the schools don't want you to quit. So,
and the other thing too, when you drop out of your residency program, all the other residents have to pick up. So there's a bunch of unhappy residents now that have to pick up slack for someone who dropped out. So yeah, they're not going to push you out. I mean, you see a lot of movies and TV shows that are a bunch of baloney because they try to treat residents like we have a whole wellness team that they give like Grubhub coupons and stuff like that to residents so they're happy. And so they don't want you to drop out, but they also want you to work. And because, you're making them money, but also patients depend on you and everybody else depends on you. So it's not like they're not trying to push you out or something.
It's like being in an apprenticeship is a good way to look at it. And so you will feel like you are, making money for other people, and that sucks. And it does. But you're learning and you're focusing on your future earning potential. And then, like, depending on what you're doing in a day, there are plenty of days that I work very hard and I'm keeping the hospital going. But there are also days where I spend the entire day learning and I contribute nothing to the running of the hospital. So they are paying to teach you and are paying for your learning opportunities, to send you to conferences, to help you do research, to pay for your meals, to my hospital pays for my phone. Like they are doing these things for you. So, and they want to keep you at the edge of what they can get out of you, but not have you drop out. So, yeah. So they want their money back, but they don't want you to drop out. So their goal is to not push you over the edge.
I have a question. How did you decide orthopedic surgery and why?
Oh, it's what I wanted to do because it's kind of what I was doing in the military. And I really loved it, but we had a lot of freedom in the military to do things we can't do civilian side. So, and I really realized early on that I love working with my hands. Like I said, I started way back in high school in culinary arts. Like, I love working with my hands. I like little projects. I like using my body. I love that the elements of surgery are so physical. I don't like just sitting in a room in front of a computer, which is a lot of what you do in kind of the cerebral medicine side of things. We run around the hospital, we do stuff, and I love that. And I like the power tools, but I think one of the biggest things about medicine that you realize once you're in it is that it's about personality. And people think that a doctor has a specific personality, but it's not. It's like there are doctor personalities, but then within that, there's all these specialties and they all have different personalities. And I knew that I wanted to be an orthopedic surgeon because the first day I worked with the orthopedic surgeons, I felt at home. And I think not at home with the like stupid bro jock culture that is described in, you know, every meme that we all see about orthopedic surgery. But the down to earth family, it's kind of like being in the military where we're kind of like all squad together and we work together. We all sleep in the same room when we're on call together. You have to be in close proximity to your co-residents and your attendings who are teaching you. Like, you can't sit across the room and learn how to be an orthopedic surgeon. Somebody has to put their hands on your hands and say, do you feel how this bone feels? And so there's contact with your patients and there's contact with your coworkers. And I think it creates a very close-knit family culture, which works for me super well. But they're also, like, by and large, really laid back folks that like to hang out together outside of work and relax, have a good time, and I like that.
We have one question. Someone is asking, did you have a mentor and or mentors, and how did you find them?
I have both mentors and sponsors, which if you've never heard those terms before, mentor is somebody who you would like to emulate, somebody who is maybe participates in your life in many ways, both personally and professionally, somebody who you can look up to and can offer advice. A sponsor is somebody who helps you to achieve something. So they're the person who's sitting at the table if you're not at the table and says, you know who'd be great in this position? You know, Ani would be great in this position. Somebody who's going to open those doors for you to move in your career. And so I have both sponsors and mentors, and I am always looking for those. Mentorship relationships, I think, begin organically. My number one mentor throughout medical school was somebody who I had worked with in the military as a nurse. He's an orthopedic surgeon. And he mentored me when I was a nurse. Then I got out and went to medical school, started working, and he got out of the military and started working, and we happened to end up at the same hospital. Just purely, we didn't know we were there, and we just ran into each other one day. And so he ended up working with me as a nurse in the military, as a nurse in the civilian sector, and then also as a medical student. And so we had an incredible amount of continuity over 7 years of this relationship, and he was able to mentor me through the transition into becoming an orthopedic surgery resident. And so he was both a mentor and a sponsor. I also have female co-residents who are more senior to me, and also female attendings who mentor me as a woman in orthopedic surgery. I have other people who I can go to and say, hey, I'm interested in doing this. Will you open a door? And they'll open a door for me. Finding those things is about networking. It's hard work. It's hard work for us introverts. You have to talk to people. You have to cold call people. You have to show up to the mixers. You have to be on the research projects. And it's something that will happen over time. But the ways to do it, if you're in school, I know like my school has an alumni organization, and I've had many students reach out to me I just put my name on a list. You can reach out to, if you're in medical school, you can reach out to, or even, I think maybe even your office of alumni at your university or college would maybe have a list of people that you could contact. They keep a list of everybody in certain specialties who said students can contact me at my medical school. And so students can reach out to the professional development office and say, hey, I want that list. And they can basically just cold email or cold call anyone on that list. And those people could be mentors or sponsors. So I would say it does happen somewhat organically, but putting yourself in the opportune moment, such as in volunteering, research, networking, things like that, that'll get you to a place where you can find those mentors and sponsors more easily.
And we have another question asking if they want your perspective on whether working as an EMT during med school seems possible.
Oh yeah, I totally forgot that. Yeah, I was an EMT when I was in college. I got my EMT license. I volunteered as an EMT. I think it might be in the same way that nursing is, because it's a very like shift bound job. I can't speak to it because I didn't do it, but I think if you had all your certifications and everything like already in place, and you had some experience and could also obtain a somewhat flexible position, then I do think it's possible in the same way that being a nurse would be possible. And as a nurse, you could, like, I was nowhere nurse, but if you were like I don't know, an ICU nurse or whatever, you can have that same kind of flexible job in any area of nursing if you have the experience and the certification.
Yeah, I'm an EMT, and the only thing is that getting
Yeah.
to start out, the only place you could really start working as an EMT is on an ambulance. And I could tell you that EMTs on an ambulance make about 1/5 or 1/6 what a nurse makes. So you got to look at the cost balance of working 24-hour shifts. And plus, EMTs on ambulance work either 24-hour shifts or 12-hour shifts. You rarely can work 8-hour shifts. And it's just really hard. But if you're able to find the hours that could, to do that, but again, it goes back to the cost benefit. Plus, the other thing is you don't get as an EMT time to. I mean, you could sit in the ambulance and study, but it's it's challenging. But it's doable if you want to do it. But all I gotta say is that the cost balance is for how much loans you're taking out to what requirements you have, the money you're going to make working on an EMT as an ambulance. You'll make a lot more money if you work in the ER, but again, I work in the ER as an EMT, but I have experience, and I have a lot of experience, and I've got extra certification like phlebotomy and EKG and a bunch of other stuff. So I make quite more, but also my boss doesn't care. Like I have Calc 3 exam coming up or organic chemistry. I got to work. And plus, I work in a county hospital, so I'm a civil servant. So if there's like a disaster, mass shooting, COVID, like they want your butt in there. They don't care about you got to study for an exam, your schedule. None of that stuff matters to them. You got to be there. They're depending on you. You got patients, and so when you're in medical school, if your boss wants you to work a 12-hour shifts as an extra carb, you're gonna have to do it. So it's just, think about it.
I think we might have time for just one more question. So someone's asking if it's true that the most annoying part of being a doctor is fighting with health insurance companies for best treatment for the patient.
Maybe. I think that there are a lot of annoying things. I would personally think that charting is the most annoying thing for me at the moment, but as a resident, I do a lot of that. It is frustrating to fight with the insurance companies, and it is something we talk about a lot, and lobbying and how we can protect our rights as physicians and how we can protect our patients to get the best care. But these are all things that you basically decide are worth the hassle in the effort to take care of people. And then I spend my time helping people as best I can and try and advocate in whatever way I can to make things better for people.
Okay. Someone else asked, what is the best major to become a doctor?
There is not one. Just the major that gets you time to do well on your prerequisites for med school. It's more important to do well on the prerequisites for med school and the MCAT than it is to have a specific major. Although I would say I had friends who majored in biochemistry. That was quite nice. And friends who majored in physiology, and that was a huge leg up because they had taken a lot of classes that were very similar to the classes we took in medical school. That's just personal opinion, honestly. I knew people who did everything.
All right, last question is someone's asking, is it difficult to balance your love life while in med school, or I suppose, relationships that are important to you?
I'm not the person to answer that question. I am the only relationship I have is with my son. But I can tell you, as a person who has a child and does not have a partner, these things are on my mind. I think it is important to me to eventually find a partner. I would love for that to happen in my life. And yes, it's hard. I have worked every day for the past 6 weeks. So I just had somebody recently ask me like, oh, well, have you been on a date recently? I'm like, what do you mean? I go to the hospital, I work 80 hours a week. I don't have time for that. So, and then I come home, I take care of myself. So yes, it's hard. But I know lots of people who have started relationships that are people they're now marrying. I know people who very satisfying long-term partnerships. People who've had children, people who came into medical school with a long-term partner. If it's important, you will make time for it. And I can say that even though at the moment I'm not making time for it, but because it's not as important as the other things in my life, like doing law and residency and being with my son. So, but hopefully soon there will be time for it. So that's the thing. If it's important, you'll make time for it. And I think all the studies show that people who have a good support system in medical school and residency have better mental health and feel more optimistic about their profession and their work. So although I don't have a partner, I have a highly supportive family and friend structure and an amazing residency. So I think that that's really what counts. It's worth spending your time on if that's important to you.
It is more important to finding the right person than any person.
Yes.
The right partner.
Absolutely.
Well, I don't think we have any more questions. So
Wow, we did it. It's amazing.
yeah, and I'm gonna put your Instagram on in the chat. So.
Oh, that'd be wonderful. Thank you. Yes, everyone is welcome to come on over to my Instagram and see my crazy life. And I try and post there as often as I can. I'm trying to do better, but I got a little off track the last few weeks with work. But my DMs are open if you want to send me a message. And I'm happy to help. Thank you so much for having me. It's been really fun.
Just want to make sure I'm typing it correctly.
That
Right?
looks great to me. Yep, that's it.